Welcome back to Good Morning SKN. International Day of Action for Women's Health is observed every year on May 28th. On this day, activists, organizations, and communities raise awareness of the critical, interesting issues that threaten sexual and reproductive health and rights and justice of women. The aforementioned bodies also hold governments and global institutions accountable and demand actions towards SRHR. There have been hard-fought gains in health, and SRHR won by social movements worldwide. In studio this morning to tell us more about the meaning of this day and how it was celebrated, here in our federation is clinical instructor Miss Mary Caines. Miss Mary Caines, good morning and welcome to GMSKN.
Welcome back.
Good morning.
So let's dive right into the discussion. How long have you been working in the field as a clinical instructor?
For the past 6 years.
6 years?
Okay. So you're fresh in the field.
And how is it going so far?
Good.
Awesome.
All right. So we are here to talk about women's health. What is this year's theme, and how seriously is this issue taken here in the Federation?
Okay, for the women's health, it's a global action in order to ramp up the services in terms of accessing for care for women, more or less feminizing poverty and providing government with accountability and prioritizing health services provided for women.
Okay.
For this year, it was celebrated, and this main focus for this year was in order to help to increase the awareness in terms of a call for action upon the government side, and for us as women in the Federation, women organizations within the Federation.
Okay.
And nurse, what are some of the important health issues that most women should be aware of?
All right. One, women and HIV and AIDS.
Okay.
That's still a topic that's out there, and it do affect us. We Federation recently in 2017 was certified as one of the Caribbean nations to eliminate mother-to-child transmission of HIV, syphilis, and now coming on stream would be hepatitis B.
Okay.
And these are viruses that can be passed from mother to child. So we were one of the 6 countries in 2017 to be certified.
Nice.
And
Congrats.
we have maintained our accreditation since. In that, we monitor our mothers during pregnancy, ensure they are tested, screened for HIV, hepatitis B, syphilis, and once positive, we treat the mom while pregnant, preventing the infant from developing any of those viruses at birth. And we continue the monitoring of the children after birth.
Okay.
And that's one major step within the Federation, and we are proud of. Also, recently, we've been certified, the hospital, the main hospital, Joseph and France General Hospital, has been certified as a baby-friendly hospital. So we have been pushing towards having our babies exclusively breastfed for the first 6 months. And we know breast milk is vital to our infants and their development. Helps with decreasing the rates of NCDs. It also helps, the intellect is very sharp for breastfed babies, right? So we have been promoting breastfeeding. The only challenge that comes is when moms go back to work. They go back to work at 3 months, given the time span for maternity leave. So then they are separated from their infants, but we always encourage mothers before they leave the hospital. We teach them about expressing the milk and having the milk saved for the infant when they're in their care, and then they continue breastfeeding when they return home.
Is there anything in place to maybe let me put it this way, moved the return to work to 6 months instead of 3, since it concerns a woman's health and also the health of a baby?
Not as yet. We would love it to be moved to the 6 months, but what we also have been doing is encouraging the workplace to provide a environment, safe environment for mothers to express milk during their break times.
Okay.
One initiative that took place years back was the building of the industrial site preschool.
Okay.
So factory workers can just walk across, breastfeed their infants, and return back to work.
Okay, that's a great initiative. What about those moms, before we continue, that cannot express breast milk and it's difficult for them?
For mothers, not all mothers are given the privilege of having to breastfeed. For instance, mothers who are positive for HIV, we have not been promoting breastfeeding. So we have been providing the service from social service to provide formula feeds for those. And those are based on medical recommendation by a pediatrician, so they would have formula feeds. So we provide that service for mothers who cannot breastfeed.
Okay.
And that's so fascinating. Can you imagine mother being tested positive for HIV, and yet when the baby is born, due to steps taken, the baby can be born without the virus? That is awesome.
Yes.
That is. And speaking of International Women's Health Day, what were some of the activities? Are you aware of any activities held in the Federation to commemorate the day? Did they celebrate the day here in the Federation, or nothing was held? Okay, but I'm sure in the near future they will.
Okay.
In recent showing of the documentary Below the Belt by Lake Health and Wellness, it came to the fore that certain health conditions pertaining to women are not taught in schools. Education and proper information is the key to success. What is being done to advocate for such measures to be introduced into the education system in our federation?
Okay, I have been in touch with Lake Health and Wellness. I've spoken to Abby, and she has started a new program teaching young girls within our federation about menstrual health. Letting them know about the myths and the truths about mental health, or the facts. And she has that program should be able to help our young girls going forward. Because many have that misconception when it comes to their menses. They're not comfortable in the public because as boys, girls, we tease each other, especially when we have that clue that something is happening. And also for our young girls, when it comes to their menses, we see it as, oh, you should be having pain, you should be having discomfort. But there are underlying conditions which create such discomfort. And the girls cannot attend school. They are afraid to do things. So it becomes more of a psychological issue on their part also. So this initiative in teaching our young girls about their menstrual health is a plus.
Certainly it is.
Okay, that's good, because even at that screening, it came to fore that a lot of people were not familiar, or they said they weren't taught about endometriosis in school, and that's something that we suffer with, and we start from early age, as you would have said. Some girls missing school, maybe that could be one of the issues. So I think it's very important that we really advocate for women's health here in the Federation and ensure that these things are taught to the young ones.
Of course.
So let's talk about contraception and the elephant in the room, abortion. Is it legal in our federation, if I may ask?
There's some aspect of it that's legal. That's where it's medical reasons for determination of the pregnancy. And the doctors would educate the women about those choices. For instance, if you do an ultrasound during pregnancy and there are malformations, which more at birth can place as a challenge for that infant and also the mother, then the doctor can choose. The mother chooses. It's her choice. It's not the doctor's choice. It's her choice as a woman to say whether she will continue pregnancy or not. But he would provide, the doctor, he or she will provide enough information in order to help her to make that choice. So it's not where anybody else chooses for her, she chooses for herself.
Okay. Because in some countries, we see the US, in some states, you can't do that anymore. It's criminalized. Right. In Hungary, it's the same. In Poland, it's the same. I was surprised to see that Japan and Thailand and Spain has made considerable strides to ensure that women's reproductive health is better.
Yes.
Oh, wow.
And speaking of abortion, nurse, what about those females in particular who would have become pregnant, let's say through incest or rape? And because persons still out there believe that abortion should not be legalized, but you have women out there should have the say if they want to bring that child into the world, because some women are in fact raped, and their brother or uncle or some family member through incest might be, get them impregnated, and I think they should have this say whether or not they want to bring that child into the world. And so persons should look on the brighter side of when it comes on to abortion. That's my personal
true. And
belief.
I agree, it is the female's choice to choose her way. But our laws, they make provisions for those cases, those special cases.
Right.
So we see in the documentary that was provided that the first call of action for the multi-year campaign on preventing maternal mortality and morbidity. How important is it for women to have access to information that was once hidden from them concerning these two issues that I just mentioned?
It is very important because we need to understand when it comes to our own body, what conditions, how do we treat what conditions. For example, we have an increase in terms of hypertension, diabetes, and it's more prevalent in women, right? And having that information, knowing what the statistics are, not just having where it's, everybody in the family has it. Having the information as how to treat it, how do you maintain a healthy life after being diagnosed, and that information is being shared with the public and women through counselors, through dietitians, right? At the nutrition office, for example, if a patient is at the hospital newly diagnosed, they are referred to the nutritionist, the dietitian comes have that conversation, or the nutrition officer have that conversation in terms of diet and control. But not all instances can be where it's treated through medication, but some can just be through diet, exercise.
During the break, I was asking you about the care that we have for women here in St. Kitts, because you mentioned the various diseases, and not all women can afford to go and pay for a counselor because not all of us are in the same standing in life. What is in place for, I know as Caribbean women, we say we're strong. We normally see these things in the bigger countries like Europe and the US, where we hear about postpartum depression, but here we don't hear about it, but we know there are women that suffer from it. So what is in place here in St. Kitts to help these women? And if there are women that suffer, why are they afraid to come out and say that they are?
Okay, in regards to postpartum depression, we know this happens after what we call baby blues. And some mothers might show symptoms while on the maternity ward, and we intervene. We ask the psychologist to come and have a conversation with that woman, find out exactly what's happening, and the counseling continues even after discharge from the hospital.
Okay, let me ask one question before you continue. What are some of the symptoms?
For postpartum blues, the mom she'll start to withdraw. Withdrawal from the baby, and more or less goes into a shell. So we always monitor them, encouraging breastfeeding. The mother will be reluctant to interact with the infant, reluctant to, more or less, they're in a depressed state. And once you start to see that coming on, then we have to intervene. One, the mother's health. Two, the infant. So we assist her. So we provide that service in terms of having the psychologist come and speak with her and see how best we can bring her back to the state where she is ready to take care of her infant. Sometimes it takes a few more days in the hospital, but the infant and the mother is cared for. On discharge, they are given a referral to see the psychologist, and counseling continues. If it happens where it's in the district, the district officers, community nurses, once they pick up on those cues, then they'll have the mother referred to the psychologist also to continue that service, to provide that service in order to help them.
And why they're not coming forward for those that may struggle and are not able to go and pay their own counselor? Why do you think they're not?
One thing when it comes to health, and it's a burning topic within health, confidentiality. Many persons are fear of the stigma and discrimination they might face in society, and also which might come off from the healthcare providers also. We have been training our healthcare providers in terms of dealing with stigma and discrimination for vulnerable communities.
Yes.
Right, so the training has been going on in order to help us as healthcare providers to provide that safe service for our community members.
Okay. And for persons who may be suffering from postpartum depression and are looking at this program at the moment and they just listen to all that you said, could you direct them as to where they can go exactly to get the help that they need for their postpartum?
The health centers within your community, you can have a conversation with the nurses there. And then there is a counseling center, which Miss Blake, Michelle Blake, she's one of the counselors at that department. They have a varied amount of counselors there. Have that conversation with them.
Good stuff.
And Nurse Caines, what is infant morbidity? And what are some of the morbidities that continues to affect our newborn babes in St. Kitts and Nevis?
When it comes to morbidity, we have crossed off. We have eliminated HIV, syphilis, congenital syphilis, and also hepatitis B, right? And some of the others we have seen are, we know, jaundice.
Jaundice, right.
Neonatal jaundice, where the infant skin, eyes are yellow, shortly after birth. And once we've recognized that, we intervene with sunlight, which is natural sunlight that helps, or we use the LED, the fluorescent light, in order to help to bring back down. What actually happens during when a child is jaundice is where the red blood cells are not broken down. So the baby has it too much, so the bilirubin inside the system builds up and gives the skin that yellow color. So once that starts to decrease, we increase fluid intake for that infant and also provide that extra lighting for the infant. And it helps to decrease it. When moms are discharged and we've realized that there's a tinge, we advise them, take the baby out in the sun. Have that afternoon walk with the baby in the sun, morning walk in the sun. And it helps. And they continue the care with the community nurses.
So there's somebody to check to make sure that they're doing what they're supposed to do?
Yes.
What about the mortality rate? That's the sad part. We don't like to talk about that, but what is our mortality rate here in St. Kitts?
For infants, we have been struggling. One of the main challenge, it's not that the rates are high, but measured against the other countries, and our population is very small. It's normally measured based on a population of 100,000. We do not have that amount, so our rates would always be more. At current, I think from the last stats that I read was about 14%.
That's still a bit high.
Yes, but then if we look at it based on our population, it can be lower. But because they rate it at 100,000, it's large. But we've been trying to get it down.
So what measures is the Department of Health taking, would you see, or have you seen any growth and strides in terms of more emphasis, more resources being placed on women's health here in the Federation?
There has been some strides, yes.
Okay.
One, the breastfeeding initiative,
Okay.
the elimination of mother-to-child transmission of HIV, syphilis, and hepatitis B.
Okay.
We have also seen strides in terms of, in regards to NCDs,
Yes.
because the ministry have increased their efforts in terms of reducing the burden of NCDs through SKN Moves initiative.
Yes.
Right. So we have been doing our work.
Okay.
Awesome. And my final question for you, Nurse Caines, is how important it is for pregnant and lactating mothers to attend pre and postnatal clinics?
Oh, thank you so much for asking. That would have been my wrap-up statement.
Okay.
All right. It is critical because you want to ensure that at the end of your pregnancy, you have a healthy baby.
Right.
Okay.
You are healthy also. So the services are available. Antenatal care, it's free at the health centers. You you'll get your treatment, your vitamins, you'll get your lab works done, and you'll also have nurses who will give you counseling in terms, prepare you for breastfeeding, preparing for labor and delivery, and prepare you for after. So the services are there and they are free.
You heard that here.
They are free.
Free, 99, free.
Awesome.
And we want mothers to access the services, right? Now, the percentage of mothers who do access antenatal care is, say, about 98%.
Oh, good.
But that 2%, it can be critical because once you don't access any kind of antenatal care, when you do arrive at the hospital at the end of your pregnancy, you are HIV positive or positive for syphilis, then it means that there's a risk of the infant developing those diseases. So we try to prevent that from happening. And also during pregnancy, there are other conditions that can affect the mothers. High blood pressure. They can develop gestational diabetes. From high blood pressure, they can develop a condition we call eclampsia, where the mothers can have seizures. So we try to monitor our mothers. So that's why it's critical for them to access the services that we provide. Attending your private, we're not saying do not go to your private doctor, but you can also go to the health centers and get that one-on-one care that can help you throughout your pregnancy.
For the impoverished mother that cannot go to the doctor, the health center is her destination.
Yes, it is.
Okay. Just making sure that they know that.
Yes.
Because they may say, I can't go to a doctor, I can't afford to see a doctor every month, but you can go to the health center. So it is up to us women to take ownership of our health while we still hold the governments and other organizations accountable to help us to get where we need
and
to.
don't forget, there's no excuse. It is free. Ladies.
Very free.